Okay, I think we're going to go ahead and get started. I think we probably still have some folks logging in, but there's a little just housekeeping we'll do here up front, and then we'll dive into the content. Welcome, everyone. We're so glad you're here. This is the first time the partners group has been gathered in far, far too long, and we're just delighted that you have chosen to spend your afternoon with us. I think this is going to be some great content, and we're just really excited to get started. So a couple of items really quickly. First of all, I want to mention, and if you've been watching our news feed, our social media news feeds or newsletters, you know this, but our public input survey is currently open. And that's a big deal because it only happens every 5 years. And as some of you probably know, that's how we gather input from the disability community all across the state of Tennessee about what disability services are working, what's not working, where the gaps are, what the big needs are, what's really important to you and your family. And we use that information to give a snapshot of the disability services system in Tennessee, but we also use it to help us shape the goals and the work that we're going to be doing for the next 5 years. That really forms a key piece of input that we use to write goals, and that will guide our work all the way through 2026. So if you haven't filled it out yet, please, please do. There are a few groups that we especially really need to hear from. We need men. So if you're a male member of the disability community in Tennessee, we would love for you to fill that public survey input out. We women are totally on it, but we need to hear from the men. We would love to continue to hear from people with disabilities directly. We have lots of input from parents and family members. We'd love to get a lot of input from folks who themselves have disabilities. And then we're always interested in getting the perspective of people who are members of racial minority groups. So if you're a Black Tennessean, if you're a member of another racial minority group in Tennessee, we would love to hear from you. Those perspectives are really important for us to get a full, diverse picture of the disability services system and of our community and what the needs really are. So that's just a big plug. That link has gone out in our e-newsletters. It's on our social media feeds. And actually, Kat will be sending it out here directly to our partners network again pretty shortly. So definitely look for that link and be sure to fill that out and share it with your community. We would love to get it out as broadly as we can. So with that said, I am actually going to dive right into introducing you to Kat. This is the first time I think that y'all have probably interacted, most of you, some of you have met her other places, but that you've gotten to interact with her virtually face-to-face. So as y'all know, Kat is our Director of Leadership Development. She started in January, I think, right, Kat? So about 7 months.
February, 1st of February.
1st of February, all right, thank you. So she had the strangest onboarding experience of any member of the council staff, because just about the time she was getting moved into her office, all the offices shut down and we all got sent home. So it's been quite a ride for her, but we are just delighted she's here. I think y'all are going to love her as much as we do. I'm just going to give you a quick synopsis of her background. Y'all probably know some of this, but she previously served with the Department of Children's Services. She was the Interstate Compact for Juveniles Commissioner. And in 2019, this is a big deal, she received the Governor's Award for Excellence. So that's a fun thing to know about Kat. She has a communications degree from the University of Central Arkansas, and she has 2 master's degrees because our Kat is an overachiever. She has a master's in public service management, and she also has a master's of social work from Tennessee State University. And the big thing to know about Kat, too, is that she's a very proud mama to Tyler, who is a beautiful young woman with disabilities. And if you haven't looked up some of the emails that Kat sent out about some of her personal background, I really encourage you to go back and read them because she's got a fantastic story. So that's Kat, and I am just going to go ahead and turn it over to her, and we're going to keep things rolling. Kat, it's yours.
Thank you, Jolene. Can you hear me okay? Awesome. Good afternoon, everyone. It's so great to be with you this afternoon for our Partner Summer Webinar presentation on home and community-based services in COVID-19. As we continue throughout this year, we plan to bring you additional webinars that involve topics that matter to you. We will have a question and answer session after this presentation, but also feel free to write your questions into the chat box for us to have on hand to begin that segment. If you also are using a screen reader to access the WebEx today, try using Shift and F10 key to open the options for various panels, and then choose chat for you to be able to chat with us also. If you're unable to do that, then please send us an email, and we'll be happy to get back with you after the presentation to get your questions answered. I wanted to do just a couple of fun things to get us started in the chat box. So I'm going to ask you a couple of questions. These aren't hard, but please share your answers in the chat box. I'm also going to write the question in the chat box. So here's our first one. I don't know about you, but I love to eat. And so I want to know from you guys, what is your favorite food? Hopefully you've been trying some summer goodies, some new recipes while you're COVID bound. So share some of those things you've been trying to cook. Chocolate brownies, lobster roll, oh, yummy. And it's right after lunch. Anything else? Well, I know everybody has a favorite food out there. Steak. I love ice cream, even though it doesn't like me. I love ice cream. Hot wings, crescent roll stuffed with chicken. I think we need to start a partner's recipe cookbook. Maybe we can do that. Hot wings. Those are all some favorite foods. I love it. Wonderful. Thank you for sharing that. Our second question for today is, we know that many of you have been busy since you've done your Partners in Policymaking classes. So what is a goal that you've achieved in the past year that you can share with us? It could be partners related or not, but something, a goal that you achieved in this past year. I know for me, since being home somewhat for COVID, I really got my garden started this year. That's something I've been wanting to do in bits and pieces, but this summer I've been able to finally get that done. Someone stated, Corinne stated that she was sent to DC on behalf of Delta Airlines to advocate for human trafficking. Wonderful. Patty said, supporting my daughter's new attention to advocacy for herself and her brother. Wonderful. Tanika started a new job. Sandy helped hire the best silk ed. Also got a beautiful patio going. A couple of new gardeners here. Oh, here's a great achievement, reading the whole Bible. That's a feat. Wonderful. So some great accomplishments this past year. And hopefully we're setting some new goals as well for the coming year. Thank you, guys. And our last question to test out the chat box is, and I forgot to write the last one. I apologize. Where is your dream vacation location? So where is your dream vacation location? Say that real fast. That's a tongue twister. I don't know about you, but I love being near water. So anywhere there's near water. Alaskan cruise, Scotland, Hawaii. Those are all great places. So many wonderful places to see in the world. And oh, staycation while the family goes elsewhere. That's an awesome one. I'm sure many of us could relate to that, especially if you've had kiddos home all summer. So it's important, that self-care piece, to carve out time for yourself, certainly during this time. So wonderful. Thank you guys for sharing that. So as we continue to move forward, I appreciate you sharing your favorite things and fun things that you've been doing so far. That was a fun activity. Now to get to our presentation for today. Our presenter, some of you may already know, but for those of you who aren't as familiar, I have the pleasure of introducing you today to Lauren Piercy. Lauren has worked as the Council's Director of Public Policy since fall of 2016. Before joining the Council, she worked at the Division of TennCare helping oversee Tennessee's waiver services. Prior to moving to Tennessee, Lauren spent 6 years in Washington, D.C., working at the National Governors Association. While there, Lauren staffed the NGA's signature initiative, A Better Bottom Line, employing people with disabilities. Lauren is an honors graduate with a master's degree in public policy from George Washington University and achieved her bachelor's degree from the University of California, Davis. So help me and please welcoming welcoming Lauren for today's presentation. Take it away, Lauren.
Thank you all so much. It was fun seeing all of your responses, and I laughed out loud at the staycation. And also shout out, Sandy, I saw your shout out to Dora, the new executive director for the Silk. We're really excited about that too. So great to have you guys all on today, and wish we could be in person. So we polled all of you, or surveyed all of you, about your interest in topics that we could cover virtually. And as Kat said, we want to keep doing this. So we are going to mainly cover the most popular question, which was about home and community-based services. We're also at the end going to cover some of the other topics that came up a lot in the poll results. So we want to make sure that even though we're not doing dedicated webinars at this time on those topics like special education and hospital care during a crisis, we are going to address how you can get more information, because there's some great resources out there that we didn't want to duplicate. So in the middle of all of that, we want to get your questions and your thoughts. We always learn a lot from you, Partners graduates. And so even if you don't have a question, but you have a comment or a story, we want this hour and a half to be interactive. Please use the chat box and don't feel like you need to save questions until the end. I have a team, as you can see, with Emma and Jolene and Kat helping me manage. If I'm not seeing a chat, they'll interrupt me. So that's the format, and here we go. Just get my slide advanced here. So this is hopefully major review for a lot of you, but just so that you fully are oriented to where we're coming from, we like to remind you that we are the Council on Developmental Disabilities, and we sit in state government, but really this image is who we are, because we state employees are vastly outnumbered by our citizen members, many of whom are on the call today, and also Partners graduates, which I'm really excited about. And I just saw Roddy's chat. He must not have been at this council meeting, but Roddy's in other pictures of our full council. As you can see, we work really hard to recruit our council members to reflect diversity in many areas. So different types of disabilities, not only your intellectual disability or your developmental disability, although that's incredibly diverse in itself. We have people who have sensory disabilities, who use wheelchairs, who have acquired a disability later in life, who've been born with disabilities. And we have immediate family members of people who have disabilities. So that in itself gives our council, who guide us, very diverse perspectives. But then, as you can see just visually in this picture, we also recruit for different races, different ages. And then what you can't necessarily see visually is that our council members represent all areas of the state. So as you probably know, we're not only 3 grand regions, we're 9 developmental districts, so split into 3 within those regions. And so we really pride ourselves on having a pulse on what's happening across the state, not just in Nashville. And then the final thing I'll say is intermixed in this picture are our state colleagues at other agencies, including TennCare and DIDD. So we all sit together once a quarter and try to keep each other informed, not only state agencies talking at citizens, but vice versa. Citizens, we are assuring the citizen voice, is how our law reads, in policymaking. So the back and forth is, I think, what makes us very special. So I won't belabor that point, but we do like to spend just a minute talking about who we are as the council before we dive into the content. So really quickly, in case this jargony word, home and community-based services, has not been fully explained to you in a few years or ever, it's really a Medicaid term that refers to services that are mainly non-medical. So help with activities of daily living and employment. So for a long time, home and community-based services might look like help transferring out of bed, help cooking, some of those more traditional services. And then they've evolved, especially over the last 10 years, to include focuses on employment and volunteering and meaningful engagements in your community, transportation, some of these social determinants of health, to use another Medicaid term, that Medicaid has started investing in. And so what makes them different from how Medicaid long-term services and supports looked before HCBS is that they're provided in the person's own home or in the community in the case of something like employment, rather than in institutions or other isolated settings like assisted living, nursing homes, that sort of thing. So I'm going to pause real quick and just see if there's any questions about home and community-based services.
We do have one question here, Lauren, in the chat box from Julie Farrell. I currently am my daughter's PA. I had my conservatorship amended to be a paid provider. With all of the new changes, will I still be able to continue to do this?
There's no reason to think not. We haven't seen any policy amendments with that level of detail. So I don't know any reason to think that you couldn't. But it's something to watch carefully and to contact when you can. Like right now, there's a public input period open to make sure that people know the kinds of things that are really important to you or would directly impact you if they changed. So for people with disabilities and who are aging, this is what home and community-based services are for. They're for people with disabilities and people who are aging, but every state defines the target population of their home and community-based services differently. So some people have, or some states have home and community-based programs for people with autism. And some people have home and community-based services for people with traumatic issues or people who are elderly. And so there isn't a federally mandated population or certain type of disability. And they're also optional for states to provide, although every state does at this point. Over the last about 30 years, every state has started providing home and community-based services. But because they have started in our history as waivers against what was typical, it's been this patchwork of optional services that every state defines differently. So to illustrate that, it's a very fragmented system, and there's an image on the slide now that is really not important to memorize or understand everything that's going on in the image. It says state variation in Medicaid HCBS expenditures, and there are different colors on each state. And so what I really pulled the image to illustrate is that every state does things differently, spends a different amount of money. It's a very fragmented system. So that's a kind of quick federal overview and review of what we mean when we say home and community-based services, or when we use the shorthand HCBS. And so now we're going to transition to talking about HCBS in Tennessee. How have we defined it for us, since states have the latitude to do that? So we have historically, the programs that have been around the longest are the quote unquote 1915C, that's a section of the Social Security Act, waivers. And they've been operated by DIDD, the Department of Intellectual and Developmental Disabilities, long before it was called DIDD. So sometimes shorthand to refer to these waivers are the DIDD waivers. There are three, so sometimes you'll hear terms like the big waiver or the statewide waiver. These the names of each waiver have changed over time, but for the purposes of this presentation, we're going to use the technical term, which is 1915C waivers. And what those refer to are the waivers that we have for people with intellectual disabilities. That's how our state defined the programs that we would put under 1915C, home and community-based services. They would be just for people with intellectual disabilities. So that has been mostly adults, although that's not in rule. Any age could enter those programs, but because of limited capacity, we have historically only enrolled adults who are in crisis and just have no other caregiver. So really that's been because of constraints on the system, not because of any certain rules. And services have focused on a lot of support, mostly 24 hours, 7 days a week, support for people with very significant needs, meaning the waiver will provide their residential services, their staff around the clock. And part of that is because the people who are enrolling into those programs are the people who need services the most and have the least support outside of paid support. So that's the backdrop of those programs, and they actually closed to new enrollment just a few years ago in 2016, which we'll a little bit more about on the next slide. But the next longest program that's been in existence that provides home and community-based services here in Tennessee is called Choices. One of our Choices, it's really the first long-term managed care program that Tennessee launched in 2010. So it's operated not by DIDD, but by 3 managed care organizations in our state. Those are health insurance companies, Amerigroup, Care, and United Healthcare. They are for people who are that's defined as over 60 for the Choices program, or have physical disabilities. So if you're an adult over 21 and you have a physical disability, you can also be in that program. And it's really been historically focused on those more traditional HCBS that I mentioned a few slides ago, the dressing, the bathing, someone coming into your house and helping you with those things. And it was launched in 2010 as part of a different numbered waiver, as opposed to 1915C that we just talked about. It's part of the 1115, which is actually the waiver that covers all TennCare services. We're one of the few states that our entire TennCare program is in a managed care demonstration waiver. And so the idea behind it was that the same 3 insurance companies that managed all the other Medicaid services for our TennCare population would now manage long-term care for people who are elderly and people who have physical disabilities. And that program, I've seen some, yes.
We do have a question in the chat box here from Allison Bynum. Do you choose your own MCO or are you assigned one?
Good question. You can choose your own MCO, and if you don't, you'll be assigned one, but you can switch. So there are certain periods where you can switch MCOs, or if there's an incident where you feel like you need to change your MCO because of something extraordinary happening, you can ask to do that. But on the front end, you can choose. And Jean, it looks like Marie said that. And each cover different things. No, managed care organizations all have to cover the exact same thing. They all have the same 600-page contract with TennCare. And the variations are more about the human beings administering those programs, the culture at those MCOs. So, it can be a little bit intimidating if you're looking at a piece of paper that says choose from these 3 MCOs. It's hard to articulate a difference unless you can talk to someone who really loves their MCO, maybe. But contractually, there shouldn't be a difference. They're all held to the same standards and provide the same services. All right. So then we go to the newest HCBS program in Tennessee, which is called Employment and Community First Choices. And we have a couple of council members in this program. And this was added in 2016 as part of that same 1115 waiver that the Choices program and all the Medicaid services in our state are under. And therefore, it's operated by the managed care organizations, although some aspects are managed by DIDD. For example, if you don't have a managed care organization and you want to apply, the DIDD regional offices help you, and a few other things like that DIDD has been involved in. So this one, though, unlike Choices for people who are elderly or have a physical disability, this one was for people with intellectual disabilities, just like the 1915C, and then they added people with other types of developmental disabilities, which had no program to go into until 2016, because we only had the 1915C and Choices. So if you had another type of developmental disability, you might be able to get into Choices if you also had a physical disability, or if you were also elderly, or if you also had an intellectual disability. But there was a big gap that a lot of people were falling through. So that was exciting. All the new enrollment for anyone with IDDs, our shorthand for intellectual and developmental disabilities, was shifted from the 1915Cs into employment and community first choices once this launched in 2016. And services really were designed to focus on youth coming out of high school and really focus on employment and community living and independence from 24/7 paid staff. So this all created a gap between the people who still existed, who used to go into the 1915C waiver, who really needed, they were in crisis and they needed that 24/7 paid staff. So it's kind of all of our programs are trying to keep progressing, but there are still these gaps that exist because there's no just umbrella HCBS program for everyone.
Lauren, I think we have Jean Marie with her hand raised.
Yes. Jean Marie, I'm not sure if we have the ability to unmute you.
Yes, hang on just a minute. This is Emma, and she is figuring it out. Jean Marie, you're unmuted.
Okay, hi. So just for anyone listening, I am on the council and I am a member of the Choices program. And right now I have a mayor group, but when I first started, I had Blue Cross Blue Shield. And I'd just like to say to Lauren's comment about them all being held to the same standards. That's true, but I have found that a mayor group is somewhat stricter in making sure that you really do need what you're asking for, more so than Blue Cross Blue Shield. So my advice is to research the various MCOs websites and just get a feel for them and for how you might be able to interact with them.
Great, Jean Marie. And you and partners have such a strong network of people who have insight into the MCO culture. So you're very lucky and use that network.
Lauren,
Thanks,
some folks were having a little trouble hearing. So do you mind recapping what Jean Marie said?
Oh, yes. She said she's gotten to know the different cultures because she's been with she's experienced different MCOs over the years, and that it is worth, if you can, getting to know which MCO is the best fit for you. Is that a fair recap, Jean Marie?
Yes.
Great. Okay. So then this isn't a new program yet, but we're hoping any day it will be. The Katie Beckett program, which many of you may be familiar with, would be another home and community-based program for children specifically, and it's still pending federal approval. So the other thing I want to address that it sounds like everyone's already familiar with is that in July 2020, aka last month, there is this proposal by TennCare and DIDD to better integrate the services. I think I alluded to the fact that there have been pieces that DIDD has done of the HCBS services and pieces that the MCOs have done, and over time they've evolved. everyone who's in these programs has their regular Medicaid, like their doctor's appointments, their therapies, their nursing, by the managed care organizations, no matter what. So there's already kind of two systems if DID is involved, but the state is really proposing to do a more intentional step back. Let's figure out what squarely goes in managed care, what goes in under DIDD, and so we really don't have much information on that topic. And after we scheduled this webinar, we realized that would be top of mind for a lot of people. So we don't plan on recreating the webinars that DIDD is going to do on this topic, but we'd certainly be willing. We know it would be an elephant in the room if we didn't address it. So if anyone has anything in mind, we're certainly willing to talk amongst ourselves. What we planned to do was talk about the impact of COVID-19 in a very high level and national context, and how we think home and community-based services will change across the country and in Tennessee because of the pandemic.
Lauren, a quick pause here for a question in the chat box from April Meredith. How does a senior with private health insurance and no Medicaid sign up for choices?
Great question, because this is yet another fragment of the system. To sign up for choices, you go to your local area agency on aging and disability. Those exist in all 9 developmental districts, and they are the front door, the no wrong door type system for people who are seniors or aging. And so, yes, so April, here in Nashville, it's GRNC, the Greater Nashville Regional Council. That's where the AAAD is located. But if you Google 3 A's and a D, AAAD, in Tennessee, you can get to the page that shows you where they are located in each region. And they will help assess you and help you sign up for choices. And I have my chat box open, so I see Robin's question. I am concerned about possibly losing our ISC when the waiver services are realigned. And the reason, and so I see Corinne has the same question. That's a very valid concern, because right now there are 3 entities that manage services for the programs. There are state employees who are case managers who only serve one of the 3 DIDD waivers, or 1915C waivers. There are independent support coordinators, which is a model that's considered best practice nationally because it's a third-party neutral entity coordinating your services. And those serve the other 2 waivers. And then for everything else, there are support coordinators at the healthcare companies or the managed care companies. And the thought behind having the support coordination at the managed care organization is so that there's a person inside that entity that manages all of your healthcare, your Medicaid, your physical health, your behavioral health, your long-term services and supports. So I think it's a very good thing to raise right now, and to voice your concern about if you love your ISC, if you love that model, or if there's a different model, or if it's just the person that you love, whatever it is from your perspective that you think policymakers need to know, it's a very important time to do that. I wish we had something more concrete or reassuring to say, but we're in the process of those decisions are still being made. So it's a really important time to bring that up. You're welcome. So one thing I wanted to talk to you about today is I wasn't familiar with K waivers until March, and these are emergency waivers where there are some things that are just standard in all waivers. Although it's a very fragmented system and every state does it completely differently, there are certain things that, like background checks for providers and making sure that people have due process going into services. Lately, there's been this huge emphasis on getting people's services conducted outside of their home in the community. And in Tennessee, we even have regulations where unless you're getting employment outside your house, you can't get much services inside your house. So, so all of that is to say that starting in March, states all over the country had to fundamentally change the way they deliver these home and community-based services while the country was stuck at home and in lockdown. And so these K waivers, every state, I mean, the figure on the screen says states with approved K waivers as of April 16th. And there are some states that are not colored in, so they hadn't, including Tennessee. We have one. So virtually every state has a K waiver at this point in August and are operating under these very different rules, pretty much unprecedented in any other circumstance for home and community-based services. So states, changes allowed by the K waivers. First of all, states didn't have to get public input before changing their waivers, which I had never heard of, but it makes sense in an emergency. So states are allowed to do things like expand the population that they cover. So I mentioned that a lot of states have very narrow populations. Like in our state, we only covered people with intellectual disabilities in our 1915 Cs. So we could have said, we're going to expand that to a broader disability population. We could increase service limits. So if you are usually only allowed to get respite for, I think it's 40 days a year or something like that, we could have increased those limits because of these very unusual times. And it would allow for virtual service delivery. So that's something the Centers for Medicaid and Medicare have not done very much of. A lot of long-term services and supports, if you think of things like transferring out of bed and bathing, just can't be done virtually. But this pandemic has put a lot of pressure on what can we deliver virtually and limit the risk of exposure for people who are the most vulnerable to COVID-19. And to start paying family caregivers, again, to really limit the amount of people coming in and out. If people are quarantining together, it may make more sense to pay family caregivers than to have staff coming in and out. So examples from other states, before I go into what we did, because I think these are really interesting. Colorado started allowing enrollment of children into their adult waivers. In Hawaii and Pennsylvania, they added nursing settings that nursing wasn't typically allowed. In Washington, they added COVID-19 related information and training. And I loved that one because one of the things I learned on a recent People First call amongst people with intellectual disabilities, we were talking about COVID-19 and one person said, I had to learn about it on the internet. No one told me what it was. And that was just really eye-opening for me about, you know, maybe everyone thinks someone else is explaining this virus, but I thought that was a wonderful idea for a waiver service. And allowing payment for family caregivers was done in several states. This is not an exhaustive list, by the way, of every state that's done something like this. These are just examples that I know of. So continue. This is the last slide, I promise, but I just think these are so interesting. In Hawaii, they granted exception to individual budgets when needed due to COVID-19. So in April, I see your question, and Tennessee has not adopted a way for parents to become family caregivers outside of what is already available. And I'll talk about that in just a minute. Unfortunately, these are still other state examples. The coverage of PPE equipment when needed. I thought that was a really great example in a couple of other states that the waiver could actually cover the cost of getting PPE for you and yourself and your staff. And then these last two are where there's a double-edged sword of these emergency provisions. So at least 4 states allow restrictions of visitors. We actually know that Tennessee is not allowing for restriction of visitors. And then at least 3 other states waive the choice of roommate requirement. Some of you may have heard of the HCBS setting rule from 2014, ushered in a wave of regulations about choice and privacy and all sorts of things in home and community-based settings to make sure they're not just recreating institutional settings. So one thing was you have to have a choice of your roommates. Your provider can't just decide who you're going to live with. And that has been waived in several states right now. We also know, well, I'll get to it with Tennessee. So now I'm transitioning to what did we do in Tennessee? So back in March, Tennessee announced no one will be disenrolled from Medicaid, including home community-based services during the pandemic. So that was kind of okay, we know that during the pandemic, no one's going to be kicked off of their Medicaid. They can voluntarily disenroll, but TennCare is not going to be kicking anyone off, which was, I think, a big relief for a lot of families. We also heard that, or TennCare announced that there would be a big expansion of telehealth for things that have not traditionally been allowed through telehealth, like therapies. For the DIDD program, DIDD announced that they would do support coordination remotely. That's typically sometimes done by a phone call, but there's at least some measure for, depending on your needs, there's at least some regulations of you have to have an in-person face-to-face visit with your support coordinator. And that was transitioned to remote. Their RK waiver included enabling technology, which had been just a state initiative before the K waiver, to give people access to, it's a lot like assistive technology, but they use the term enabling technology to have an even broader vision of technology that you might install in your home, not use directly necessarily as a device, like a way to open the door and use the stove and all sorts of different things. Your heating and cooling all through an iPad, just like anyone else honestly could too. It's not disability specific, but it helps with independence from staff coming in and out of your house. And this is a big one. So I mentioned that over the last 10 years, a lot of programs across the country and certainly here in Tennessee with the ECF program really put an emphasis on getting away from services that are in your home and toward services that are delivered in the community. And so when COVID-19 obviously really threw a wrench in that. And so DIDD almost immediately said that if you're receiving what's called day services that are usually required to be in the community, you now have a blanket approval to do those, to deliver those services in someone's home, and they called it homebound services.
Lauren, we do have a question in the chat box. Susan Bryant asked, is there a time limit for the K waiver? How long will those changes stay in effect?
Yes, great question. I've actually had to ask this directly, even though I've read it all. I find it very confusing. There's a couple of different answers. Technically, the K waiver is in effect until March 2021, but DIDD could say these are not in effect anymore. And I think that's because everywhere is affected so differently from this virus that, for example, if in-person visits are safe again because we get the virus transmission under control, then DIDD could decide before March 2021 to reinstate those home visits and that sort of thing. So also, on the other hand, I think if for some reason we were still in a pandemic in March 2021, I think it could be extended. So it's not a hard and fast deadline, but there's a cushion until they wouldn't have to extend those to keep them in place until March 2021. So some other things that we did, and I don't think each state gets to decide how long. My understanding, this is another question in the chat, is that all states submitted their applications differently, but they were all retroactive. They were approved on a blanket basis, by the way, by CMS, which I, again, don't think has ever happened. CMS is notorious for looking at every single waiver application, negotiating about it, and approving them one by one, which is part of the fragmented system. But with K waivers, they approved everything on a blanket basis, and everything was retroactive to March 12th, somewhere in mid-March, and then extended for a year. So I think every state had that same blanket approval for 1 year that was, depending on when the state got their waiver in, it was retroactively gave them retroactive approval. So these are great questions. So in Tennessee, we also provided temporary rate increases for providers, and you can look these up on DIDD's website. They're very complicated. It's not just a given to providers. They have to prove certain different things about how they've been providing services during the pandemic, but they are available. And then they also modified provider qualifications, and many states did this. So they gave additional time for background checks. So someone could start working if they were willing to as a new employee supporting people with disabilities without a background check, without a CPR certification, without going through the normal training. They paused their home visits. They call them quality assurance surveys. This is when the state goes and visits providers and makes sure they're doing the things that they're supposed to do. And they allowed medication administration to be supervised remotely. So we know at least one person whose DSPs, whose support didn't have medication administration certification, and he was allowed to have his supervisor just on FaceTime helping him. So anyway, these are just things that would never happen in normal life. And so before I go to the testing that Tennessee also announced, are there any other questions or comments? Kind of switching gears just a little bit here. This slide is not about the K waivers, but relevant to as Tennessee was adapting our policies in the wake of COVID-19. We also announced voluntary testing for persons supported in those programs that would be tracked by DIDD. So DIDD set up a page on their website where they post the data. So how many people have tested positive, how many people have died, lots of data actually on that website. And then they, to their credit, host weekly office hours to answer any questions from anyone who wants to join those office hours. And this is been a national model. We have done more testing, offered more testing, again, on a voluntary basis for people with intellectual and developmental disabilities in services than any other state. It's been done by professionals who are used to working with this population. It's been tracked by the state. And one of the things we at the council have encouraged the governor's administration to do is expand that to people who are not in services, because we know that it's a tiny slice of the population in Tennessee that have intellectual disabilities who are actually receiving services. And it would be great if we had more data about what is happening with the whole population in our state. If you go to your local health center as a person with an intellectual disability and get a test, you're not going to be counted as a person with an intellectual disability. And so it doesn't help us understand what's happening with this population or with subpopulations within the IDP population, like children. So the department does seem really receptive to continuing to really bolster their testing program. They've just recently, in the last week or so, announced that they're asking providers to test their staff, and they have a company set up to do that, because before that, their staff who are coming in and out of their houses weren't necessarily getting tested. So all those policies are still changing day by day. Now I'm still watching the chat. I do have it open, and I would love to have more discussion if anyone raises their hand and wants to chime in. But if not, I will kind of transition to what we think all of these temporary policy changes that I just mentioned that are adapting to life in this weird time might mean for life after this weird time. And then Jean Marie says, if you're on choices and you call DIDD, you get tested also. I'm so glad you remember we discussed that. Do you mind taking yourself, or can Emma help take you off mute and tell us about your experience with that?
Yeah. Can everyone
Okay,
hear me
Jean Marie.
okay? So it was a little complicated at first because they didn't quite understand what I was asking, but eventually I got to the right person. I just called the website number that they had, and they got me in touch with the correct person. And they told me what site was close to me and took down my information ahead of time. And I just showed up, and it was very easy.
Great. And so if anyone doesn't know Jean Marie, she's on choices because she doesn't have an intellectual disability. And therefore, it wasn't obvious whether she could join in this testing initiative. So I'm glad you did that, Jean Marie.
Yeah, it was really straightforward, and they were very helpful and more than willing to accommodate my needs. So
Great. All right. So when we think about what things are going to look like going forward, and we in Tennessee have this added layer of an integration that will happen between our services, I think the big questions are going to be who provides the support. So there's the role historically that has been primary on in-person paid staff. That's been what our whole system is built on. And over time, we've had our DSP crisis where we don't have enough people who are paid, who can be in-person paid staff. We have some people who don't want in-person paid staff as their primary support. We still have a lot of people who will always need and prefer in-person paid staff. And then we also have now, in this time, uniquely, the role of expanded telehealth, which I was just reading last week. The president has said this is here to stay. This is permanent. This is not a temporary CMS initiative. And there's been a lot of articles in national news and things like that about how this has fundamentally forever changed the healthcare system toward telehealth. And of course, we in Tennessee and several other states have been on that trajectory of not specifically telehealth, but really looking to technology to help fill in the gaps, to help people feel more independent and less dependent on paid staff, help people who rely on transportation that they can't get to their doctor, even if they wanted to, and things like that. So there's a tension there, or perhaps a balance. I don't mean tension in a negative sense. And then there's also the role of family caregivers and natural supports, and thinking about, this is something that the council is really passionate about, is a framework called the Life Course Framework and Supporting Families Principles, which was a grant that our state had a few years ago. And it really tries to use a person-centered plan that doesn't just list services from one program, for example, a home and community-based services program, but instead that's one element of a person's very full life that has all these other elements, including technology, including natural supports, which is just a term for your own family and friends and community, and all sorts of other things. So is there a shift where right now we're exposing the fact that family caregivers are essential to be supported by our system? Because when there's something like a pandemic, or even when there's not, how can we support that family unit to stay intact, even if that means using some of our investment in the system to support the people around the person who's actually directly getting those services, because it actually is better it helps that person have better outcomes. So I don't have answers to any of these things. These are the things I think the system as a whole and our whole nation are grappling with as we're trying to figure out what the new normal is after. Related to that, and I'll pause for a second. He says in Memphis, MATA Plus was taking people to testing for free, but not sure if that is continuing. That's great to know. So then that's the who. And now I also think there's going to have to be a real grappling with where is support provided. So what's the role of congregate settings now that this era has really shown a light on how dangerous those congregate settings can be in something like a pandemic? What is the role of home and community-based settings? And then within home and community-based settings, where is the line for program requirements to make someone receive those services outside their home versus in their home? There's a lot of, I think, pressure for HCBS services to be delivered in employment settings and community settings. And so what happens if someone wants them in their home, especially as we're dealing with a pandemic and realizing there's a lot of virtual activities that can go on, et cetera, et cetera. So I see Robin. COVID-19, I'm concerned about my son being forced into the community when he's medically fragile. So that's a perfect example, I think, of this tension between wanting to move away from historically, I think our system has really such low expectations for people with disabilities that people with disabilities have not been welcomed into the community, and perhaps an overcorrection to let's force everybody to always be in the community. So, so I think that's what our system's going to have a really, actually, probably a very important opportunity to grapple with, because before COVID-19, we were kind of on this trajectory that there wasn't an obvious point at which it might stop. So it'll be very interesting. And I think to that point, we have to think about what programs prioritize. So in the past, it's been very clearly safety and protection. So even if that means putting someone in an institution and just making sure they're fed and bathed and safe, that was number one. And then we also have these more, I think, modern priorities, like could we prioritize the entire family unit with services? Could we prioritize employment? Because historically, people have been so deprioritized that you actually have to prove you can't work even to get the healthcare and the other social services that you need. So our system had to overcorrect, and perhaps we have overcorrected. I think it depends on your philosophy. But technology first is another term that's just come into vogue in the last few years, which aligns with these enabling technology initiatives that Tennessee has with the smart homes. And they're very careful not to say it replaces staff, but it certainly gives people other options beyond just having a human being with you all the time. So doing things for you. It kind of helps you do things yourself if that's your choice and if that works for you. And all of this goes to, of course, person-centered choice. What does that mean? And I think sometimes our policymakers are so afraid that if they don't put so many guardrails in place that it will be the provider's choice. The provider will just decide everything for the person, that they inadvertently, all these guardrails actually hurt person-centered choice, which is just a fancy way of saying letting the person design the services that they actually want and how they want them. So I think I saw a chat come up. If we keep the person-centered planning as the guide, ideally what is best for the individual should be supported. Forcing folks into the community should not be an issue. Yes. And I think the only thing that comes in the way of that is policymakers being afraid that it won't be the person's choice. It'll be the provider's choice, and the provider will have to do less if they just leave the person at home. And so that'll be the choice of many providers. That's not the right way to make policy decisions. That's kind of a race to the bottom, and it certainly isn't person-centered. So I think this is what we have to figure out as a system. And we have to have enough advocates, I think, around the person to make sure that there are checks and balances. And I think that's the best way to make sure that it's really the person's choice. Great point. So there are advocates nationally anticipating the unwinding is kind of the term of emergency provisions and pay waivers In fact, these groups started coming together in late May. We're on one, a national work group with our national agency. And I think everyone was thinking, okay, COVID-19 is almost over. We've done March and April and May, and now it's over until the second wave. And so people really started, CMS asked for recommendations from this small group that we in Tennessee Council are on. We put them all together, we submitted them to CMS, and then it became very clear that COVID's not over and these aren't going anywhere. But it's good to have these conversations started. So these are the recommendations that our national association put together and submitted to CMS. That CMS should, the Centers for Medicare and Medicaid Services should allow states to permanently continue telehealth, remote support technology, assistive technology, including setup support so someone knows how to use their technology, overtime and hazard pay for direct support professionals, personal protective equipment and medical supplies, and family members paid as support. To get back to April's question, that is allowed on a very limited basis in Tennessee, and it was not part of our K waiver. That part of the recommendations were to rebalance Medicaid funding, and this gets back to those original slides when I said that home and community-based services are optional, even though all states do it. What isn't optional for states to provide are institutional services. So as our society is modernized, and as we've even phased out institutions like we have in Tennessee for people with intellectual disabilities, advocates are now on this kick of, hello, wake up, Medicaid, you need to make HCBS mandatory. Institutions are a thing of the past in a large sense. I mean, of course, nursing facilities still play a role, but if we could reform Medicaid, and the term is rebalance so that it's not biased toward institutional services. Anyone can get institutional services anytime they want them. What people should have a right to, the advocates say, is home and community-based services. People are safer in non-congregate settings. I think we now know more than ever. It's actually less expensive for governments. It's more associated with higher quality of life. So this is hopefully something our federal government will take up. They have not yet, although it's been kind of a steady drumbeat for the last, I think, 10 years from advocates. And to require stakeholder input as states unwind their K waivers. So what could happen is states could simply expire their K waivers either in March next year or sometime before that and go back to the way things were. Or what our national group said is you should require a stakeholder group to talk about which elements of the emergency waivers should stay. And in fact, here in Tennessee, DIDD has convened a group on that topic that we're sitting on, we at the council sit on, and it's specific to day services. So just to all of your points about right now, you're required to get your services in the day in the community. So during COVID, there's a homebound exception where you get to get those services in your house. Is there some sort of medium or more flexible arrangement that we can have going forward rather than just going back to the requirements that we have had in the past? So I will, oh, I see a chat. Oh, okay, Susan, because there is such a shortage of DSPs, any thoughts for making sure DSPs have health insurance? What a great point. We have heard from people who are healthcare workers who don't have health insurance, and DSPs, I put them right there in that category of like, how could you not have health insurance? I love that idea, and we'll certainly bring that to the state, and we encourage you to as well. You partners, graduates are such important advocates in this state. That's a wonderful point. And that they are paid wage. Yes. The Department Intellectual and Developmental Disabilities have done a really good job lobbying for that, with support from the Disability Coalition and TennCare, the Provider Association. And we just need to keep on that. Huge. So please keep chats coming, or put your hand up and Emma can take you off mute. But I will make sure I go through all my slides here. So other topics, well, the topic identified by you all as the number one was what we covered today. I hope it met what you were envisioning, but if not, please write us and we can either talk offline or adapt to a follow-up presentation. But to stay up to date as all of these things continue to evolve, do sign up for DIDD's open line. And there's a link here to their Tumblr. And if you have any trouble signing up, feel free to let us know. But their newsletter contains all the announcements, really written toward professionals. So sometimes it's hard to translate into English, but that's, for example, how we knew that they were stopping the home visits and pausing the background checks and things like that. They are very transparent about their policies. You can't say that about many state agencies. So kudos to them. And honestly, if your work schedule allows, attend their office hours. They do a fantastic job answering questions. And again, I can't think of another state agency that offers anything like it. So take advantage of it. And like DIDD on Facebook, like us on Facebook if you haven't, because they do push a lot of content from the other two things I just mentioned onto Facebook. If that's the only thing you have time for, it's a good way to keep up. The second most popular topic was school reopening and special education. And this has been something at the forefront of our minds, probably the most frequent question we get into our office. And so another wonderful thing, not quite office hours, but pretty close, is the Department of Education puts their assistant commissioner on Facebook Live every single week and takes questions. And I know at least a few of you on this call right now participate in it, but you can submit questions in advance, and it's a really good way. You can watch it afterward. I've done that when I can't be there live. It's a very transparent way to connect with people who are affected by policy with their policymakers. And then if you haven't seen it already and you have a child starting school, this family decision guide helps think about, what should I be asking? What am I allowed? What are my rights? What can I ask my school to do? And things like that. So the family decision guide by step down at the left corner of this slide, hyperlinked, is a great resource if you do have a child starting school. And then the third most popular topic from the survey was hospital care and visitation policies during a pandemic for people with disabilities. And so a very high level summary is that, well, I'll start with, because I didn't know this, states had policies on the books in case of a pandemic that I don't think anyone thought would ever be used, because none of us thought we'd live through a pandemic, that said that if hospitals are overwhelmed, here's how you prioritize your patients. And ours allowed hospitals to deprioritize people with disabilities and people who use ventilators and people who had traumatic brain injuries, and it was scary. So we're very lucky that advocates in our state, led by DRT, came together and filed a complaint right away in March when this came to light. And that led to, in June, a new policy to replace that old policy. Actually, Jean Marie was one of the complainants, one of the citizen complainants. So proud of you, Jean Marie. The old policies would have directly affected Jean Marie. So the new policies clarify that no matter what your pre-existing condition or disability is, you have a right to care even during a crisis. You also have a right to a support person, even while hospitals have no visitor policies. So that's really an important piece of this guidance. And you can read the guidance, it's hyperlinked on this slide. And we also, if you want to hear more about it and ask more questions to really the true expert is Brian Keller at Disability Rights Tennessee. We are doing a webinar for the Rural Health Association of Tennessee that they have said, please, we have 1,000 slots, please invite anyone. On August 19th, the Lunch and Learn, so it's 10:30 to 12:30 Central Time. And it's linked on this slide. We'll also promote it on our Facebook, and we can certainly send you the information directly if that's easier for you and you're interested in that topic. All policy issues, my go-to federal policy news is the Association of University Centers on Disabilities. They've recently added a plain language section to their newsletters, and it's all I read. It's just such a good lesson in why plain language is so important, because that's how I understand it best too, not just for different learners or different audiences. So anyway, they have a very, very good weekly policy news for the federal level. Very close second that I don't have on this slide is Family Voices. And I don't know what frequency their newsletters come out. I don't think it's quite weekly, but they have an amazing amount of federal news, a bit more comprehensive and longer than the AUCD policy news. So those are my two recommendations for keeping up with federal policy. And then shameless plug, if you don't get our policy news, which I think you do unless you opted out, because we put all the partners on it. But I do try to pull out what I think is most important from those other newsletters and put it in ours. Okay.
Lauren, it might also, sorry, my sound is a little feedback. It might be worth pointing out that to watch our social media feeds also for more information about the integration of the programs, the HCBS programs under DIDD. We are going to be putting out more information about that over the coming weeks. So watch our social media feeds, watch our newsletters. There's going to be a lot more real simple, plain language, bite-sized pieces of information coming out about that in the next little while.
Mm-hmm. Good point. Thanks for bringing that up. So Robin asked, where is the best place to voice our concerns? And so I would have a slightly different answer to whether that's a general statement or a specific issue. So Robin, if you do have a specific issue in mind, I might answer your question more directly if you want to put it in the chat. But I think in general, working with advocacy agencies in Tennessee is the very best front line. I always encourage you also to work with policymakers directly that are your elected officials or at the state agencies. But since advocacy organizations are often in meetings with those people, sometimes the best way to do it, and they've seen the trends more globally, I think the best way to do it is to reach out to us, or if you're more comfortable, reach out to the ARC or the Disability Coalition. I don't mean to leave out any other organizations, but I tend to think that when there's someone whose full-time job is to advocate and are often in those meetings, have those relationships and connections, they're a great frontline resource to pass your concerns to. And then you can also, at the same time, that doesn't have to be mutually exclusive with contacting your own elected officials. I think that should be a practice we all do more often than any of us want to. I hope that answered your question.